Its healthcare foundation, AHF, has called on world leaders and all stakeholders to protect humanity by providing equal access to COVID-19 vaccines worldwide. The country program director, AHF Nigeria, made the call at a media roundtable on the Vaccinate Our World VOW campaign organized by AHF.
1.3 billion doses of the vaccine has already been administered worldwide. And it's interesting to note that 83% of these 1.3 billion doses are mostly in the developed countries, while only 0.3% have been administered in the least developed countries and the low-income countries. And so the disparity is quite clear, and AIDS Healthcare Foundation is hereby calling on world leaders, pharmaceutical companies, public health organizations to ensure equal access to this. If this is not done, it's a moral failure and it's also a public health failure. And the pandemic will continue to rage on. And we want to use the opportunity of the VOW campaign to stress that low-income countries should not be left to fend for themselves. There needs to be a bridging of that gap.
The country program director said there was the need to adopt and implement a public health communication strategy to increase the level of awareness across the globe.
Vaccines are beginning to be rolled out, have started being rolled out, but there's a lot of vaccine hesitancy. And so there needs to be public health communication strategies that are at the grassroots level that will involve a wide variety of stakeholders, the CSOs, CBOs, religious leaders, faith-based organizations. Everybody has to be involved to ensure that message reaches the grassroots, that these vaccines are safe, these vaccines are effective, and people should please come forward to receive the vaccines.
The General Secretary, Nigeria Union of Allied Health Professionals, stressed the need to apply the principle of social justice in the distribution of the COVID-19 vaccine.
The principle of social justice have not been applied in the distribution of a vaccine across the world. To us in the labor movement, this is unacceptable to us. And we demand that the distribution of this vaccine should follow the principle of social justice, where even the most vulnerable citizens in the global south should be taken into consideration. It is very important that we take this issue of vaccine very, very serious. And that is why this conversation is timely and apt.
The Interim Deputy National Coordinator, Association for COVID-19 and Beyond, lamented the profiteering and marketing involved in the procurement of the vaccine.
We can also not rule out the concern around the profitization, that has also been linked, the marketization of the vaccine, where profit is also a factor. And unfortunately, it is also about power relations between those who see it as human rights, basically, and those who see it as a means of also, profiteering and making more financial gains out of it. At this particular point in time, our aid or any aid that is coming to Africa, any grant that is coming to Africa, any assistance that is coming to Africa and the developing world should be tied to assistance of ensuring that vaccines for COVID-19 is democratized, is made available, and that when it is made available and affordable and accessible, so that it is not also just limited to a particular class of people, even within Africa.
The president, Lawyers Alert, a human rights NGO, said that the vaccine should be seen as a world public good and as a human right across the globe.
The need to have vaccines in the arms and protect lives, if we see it as a human rights issue, then there is an issue of ensuring that as a human being, you get it. Because human rights simply means that by virtue of being born, these rights are yours, they're innate, they cannot be taken away. And so if we look at the issue of health, the issue of of life as human rights, and they are by the charters we have and statutes, then it means that it doesn't matter what part of the world you are in. We should bring down all regulations. We should bring down all these issues and ensure that vaccine gets to everyone. VOW.
vaccinate our world.
Thank you.